Hi, my name is Jonathan Whitehead, and this is my Capstone project presentation on the use of surgical timeouts in the surgical setting. Having a surgical procedure performed is a major life event, not just for the patient, but also for family members and close friends. Surgery is not usually the first option for the treatment of an illness or disease, but oftentimes surgical procedures have to be performed. Millions of surgeries are performed on an annual basis, and this provides a lot of opportunity for mistakes and errors to be made. It's the nurse's role in surgery to provide a safe environment for the patient through accurate verification of important information prior to the start of a surgical procedure. This brief pause before surgery begins to review pertinent information is known as the surgical timeout. A sentinel event is described by the Joint Commission as a patient safety event that reaches the patient and results in death, permanent harm, or severe temporary harm. There are many different classifications of sentinel events, but the most frequently occurring in 2015 were number one, accidental retention of a foreign body. This includes towels, sponges, sharps items, or anything that was left in the patient by accident. Number two, what I'll refer to in this presentation as wrong surgery errors, and this is inclusive of wrong site surgery, wrong patient surgery, or wrong procedure surgical errors. And number three, falls injuries, which includes slip and fall injuries or incidences where patients may fall from procedure tables or things along that line. In 2015, the total number of sentinel events reported to the Joint Commission was 936. For this presentation, the sentinel event of wrong surgery errors will be the main focus. Despite the use of the surgical timeout since 2004, there remains a lot of room for improvement as it relates to wrong surgery errors. Of the more than 900 sentinel events that occurred in 2015, wrong surgery errors ranked second on the list. Even though wrong surgery errors only make up a small percentage of the total procedures performed on an annual basis, this is still a significant statistic. Every wrong surgery error that occurs has a potentially devastating effect on the lives of our patients and their family members. It's important for nurses to take the lead and do everything that they can in order to prevent these errors from occurring. One of the keys to avoiding these errors is to start the procedure off correctly by reviewing key information prior to the start of the surgical procedure. Practice guidelines for this project were derived from the Institute for Clinical Systems Improvement. These guidelines provide direction as to how and when the surgical timeout should be performed, who should initiate it, and the content that should be included. Surgical checklists can help in the prevention of wrong surgery errors. A research study by McDowell and McComb demonstrated that the use of surgical checklists to perform a consistent surgical timeout helps to prevent sentinel events and post-op complications. This study also showed that the use of surgical checklists strengthens teamwork and makes each team member feel valued in the caregiving process. The surgical checklist is a list of critical items that must be reviewed during the timeout prior to the start of the surgical procedure. These items include, first, making sure that all activity in the room has stopped and that all personnel are paying attention. Next, you want to confirm the patient, that you have the correct patient, and you do this through the use of at least two unique identifiers, which may include the patient's date of birth and their medical record number. You want to confirm that the procedure that you're performing on the patient. You want to confirm the site of the procedure, whether it's a left or a right side of the patient's body, or if you're working on the patient's spine, you want to confirm which level of the spine you're going to be working on. You want to confirm the patient's allergies. You want to confirm that preoperative antibiotics, whatever has been prescribed by the surgeon or the facility, have been given prior to the start of the surgery. You want to confirm that all documents are present and signed appropriately, and you want to make sure that all personnel and equipment is available for the procedure. And lastly, you want to give everyone in the room an opportunity to speak up and address any concerns that they may have prior to starting the procedure. This checklist provides consistency during the surgical timeout, and it just helps to do the timeout in the same manner each time to make sure that nothing is left out. Again, this helps to prevent errors and provide safety for the patient. At this point, I'll demonstrate the use of a surgical checklist to perform a consistent surgical timeout. Okay, is everyone in the room ready for a timeout? Okay, this is Jane Doe. Medical record number is 555-1212. Her date of birth is June 5th, 1968. She is having a total knee replacement on the right knee by Dr. Joseph. She is allergic to penicillin. 1 gram of vancomycin has been given by anesthesia. All consents are signed. All equipment and implants are available for the procedure. And lastly, are there any concerns that anyone has prior to us starting the procedure? At this point, the procedure can begin. As you notice, the performance of the surgical timeout with the use of the checklist only took a few seconds, but these few seconds can go a long way in preventing surgical errors from occurring. In conclusion, millions of surgical procedures are performed on an annual basis. Occasionally, sensible events such as wrong surgery errors do occur. Nurses hold key responsibility in preventing these errors from occurring. Surgical checklists are an evidence-based means of providing consistency for the surgical timeout and helping to prevent these errors from occurring. These are my references for the presentation. And at this point, we'll have a return demonstration by all participants of the use of a surgical checklist in performing a consistent surgical timeout. And that's my presentation. Thank you very much for watching.